Manthra. Today live session, it is related to Canada license process for internationally educated nurses in Ontario state. So mainly in Canada, there are 10 provinces and 3 territories are there. Ontario, Alberta, British Columbia, Manitoba, New Brunswick, Newfoundland and Labrador, Northwest Territories, Nova Scotia, Nunavut, Prince Edward Island, Quebec, then Saskatchewan, Yukon Territory. These are the 10 provinces and 3 territories are there in Canada. So in this most of the places we are doing the documentation process for internationally educated nurses. So today our live session that is related to Ontario board. What are the process under Ontario Canada registration? We will see there are mainly three categories of nurses are there. One is registered nurses, another one registered practical nurse, then other one is nurse practitioner. For registered nurse, they must have the bachelor in nursing, BSc nursing, post-basic BSc nursing or MSc nursing. They can apply for the RN program, like RN license. For RPN, those who have the diploma, they can apply for RPN category. Nurse practitioner, they must study the nurse practitioner course. Even in Canada, they can study and they can upgrade. Even registered nurses can upgrade to nurse practitioner category later on. So here, the BSc nursing candidates, those who completed recently and don't have the experience, for them also a chance is there that they can apply for RPN. Directly RN you will not get because you must have the experience. So if you don't have the experience, don't worry, you can apply for RPN category, and after working for 1 year there as RPN, later on you can upgrade to RN category. Okay, that is possible. Then we will see the details for what are the steps of application. So all the process details you can see in the website, CNO website you can see, that is www.cno.org. If you are going that, you can see internationally educated nurses, what are the things we have to complete. So now we will see what are the steps it is required for the Ontario province. First one is NNAS report. So obtain the NNAS report. So what is this NNAS? Same like a C.G.F.N.S. So National Authority to recognize our education, employment and license verification. There will be forms will be there. After paying the NNAS application fee, we can download the application verification forms, and these forms has to fill from our nursing college or the university, then the licensing council and from the employment place. And from these authorities directly the form has to send it to NNAS. But here the problem is, we know that C.G.F.N.S usually it takes around 2 months or 1 to 2 months. Within that time frame the C.G.F.N.S report will complete. But for NNAS almost it will take 6 to 8 months to complete the report. So the time frame is more here to obtain the NNAS report. Anyway, for NNAS application it costs $650 USD plus tax. That is the cost for NNAS. Here education verification, license verification and employment verification. So once the NNAS receive all the documentation from all these authorities, they will prepare the advisory report, NNAS advisory report. This NNAS advisory report they will share to CNO. CNO means the College of Registered Nurses Ontario. So they will send the advisory report to CNO. Then CNO will email to the candidate, okay, now you can able to proceed with the application, like that we will get a mail. After this mail we can start the process. Regarding the education verification form, like this verification form from NNAS, we have the college principal has to fill. They have to print out a new transcript, course completion, mark sheets, All these things they have to send courier to the NNAS. Same like nursing registration, the license. Wherever you have done the registration, those all places you have to send this NNAS forms. Even though the license is expired, then you must show the report to it. You must take the verification from that nursing council. Suppose if you have the Karnataka Nursing Council license that is already expired and you have registered in Kerala, you must provide the Karnataka plus Kerala. Wherever you have registered past years, wherever you had the registration from all that places, license verification must be completed even though the license is expired. That is very important. Most of the time applications are rejected because of that. Then next, employment verification. Verification from your employer. Past 5 years employment places. Okay, past 5 years experience places. We have to request the HR department or nursing director to fill the verification forms. That is first step. Okay, NNAS advisory report we received. It will take 6 to 8 months. Okay. Meanwhile, what you have to do means you can prepare for your IELTS English language proficiency test. They are mainly like the IELTS and the other test is that is CELBAT, then TEF and TCF. Anyway, we are familiar with the IELTS and CELBAT. CELBAT means the Canadian English Language Benchmark Assessment. Then IELTS means the International English Language Testing System. All of you know regarding that. So for IELTS, the overall score should be 7 and writing 6.5, speaking 7, listening 7, reading 6.5 and overall score is 7 must be there for accepting the application. Even it is CELBAT means, that means a Canadian English Language Benchmark Assessment Test if you are doing that one, writing 7, speaking 8, listening 9 and reading it must be 8. And another I am not talking regarding another test that is regarding TEF, tested evaluation de franchise, test the convenience do franchise like that related to the Canadian language. These tests are there. So validity for all English language proficiency test, that is for 2 years old. After 2 years, your language proficiency IELTS test report will get expired. So just start study before, but write the exam within that 2 years. That is very important. Then some waiver option is there. Language waiver option. Those who study any nursing course in Canada, or those who are working as a healthcare assistant or any jobs related to the patient care support work if you are doing in Canada, and later on you are writing the NCLEX exam and applying for the registration CNO. For them, what you have to do means you have to get the form from your employer in Canada. That means it must be verified by regulated health professional RHP who works with the applicant in the healthcare or practice setting. So the RHP, that means the regulated health professional must be active there. Okay, that means this profession must be active in his profession, and he can verify the applicant's use of language skills in English or French in the healthcare setting. So they can write a letter, and that also we can waive up for IELTS or this CELBAT. Then otherwise, if you have holding the registration, okay, as a practicing nurse with the CNO before, or another Canadian jurisdiction, if you have the license, you are also have the waiver option for IELTS. Suppose you are transferring your license from Alberta to Ontario. You have already the license in Alberta. Then you are also have the waiver option for IELTS exam. Then we completed the IELTS. We completed the NNAS advisory report. So after receiving the NNAS advisory report, the CNO will say that okay, now you can proceed with the registration. So what you have to do? We have to register in the CNO site. Application fee is $452 Canadian. So CNO will review the application and they will inform the next step. There will be jurisprudence exam. That jurisprudence exam means it is related to the Canadian laws, their healthcare settings, what we have to do there, their culture, beliefs, values, morals, everything will be there in the jurisprudence exam. That is online exam. Within 24 hours we have to complete that online exam. Okay, for that there will be little fees will be there. That is around 445.20 CAD will be there. That you have to pay and attend the jurisprudence exam. So within 15 working days, if you completed the requirements, you will get the NCLEX approval. So you will get a mail from the CNO which says that you are approved for NCLEX exam. So for registered nurses, it is new generation NCLEX-RN exam. For RPN, that for registered practical nurses, the exam name is REXPN. Okay, REXPN. REXPN exam has to write for the practical nurses. And even if it is a nurse practitioner, that is NP means the exam is CNPE. That is the exam for nurse practitioner. So based on our documents, CNO will say that you are approved for exam. Then once you register in NCSBN, so once we receive the email from the CNO, we have to register in NCSBN, that is for the NCLEX exam registering authority NCSBN, and after that we will get, that is around the cost is 406.80 CAD. So we have to register in NCSBN, then we will get an authorization to test, ATT. So there will be ATT number will be there. With that ATT number, we have to schedule our NCLEX exam. As we know that NCLEX like centers, examination centers available in India, Philippines, like that, some places only it is available. You have to check in the site which all are the country the exam is available. There you have to take a visa and they have to go there and write the exam. Then once you finish your exam, once you pass the exam, you will get CNO will receive the result. So normally within 5 days after the exam for NCLEX-RN, the CNO will receive the exam result of the applicant. And and you also will be notified regarding that. If you are transferring your score from Australia to Ontario like that, or from USA to Canada in that cases, or any Canadian authority provinces, you are transferring your NCLEX score, then it will take 15 days to know the approval for the NCLEX approval. NCLEX portion is completed then. Then after that, CNO will email, okay, you can now do the registration like that. So that time you have to do the initial registration and first year membership fee, that is around 455.39 CAD you have to pay. Then there will be police criminal record check, it will take only 5 days like that. Then PCC also you have to get clear. Then after finishing all the requirements, the College of Registered Nurses Ontario will confirm that okay, you are eligible for registration. So applicant is become registered to practice in Ontario after fully completing the registration requirements and paying the fees online. So time for complete process. These are the steps. Okay, these are the steps we have to follow to get licensed in Canada, Ontario province. So time process, that is for NNAS, as I discussed, it will take 6 to 8 months. But there is another pathway there. That is, we have to do the registration in Australia. That is AFRA, AHPR. We are doing the registration for NCLEX exam. So after registration process is easy, and you will get the exam approval within 2 to 3 months. You will get the exam approval, maybe 3 months. So once you get the NCLEX exam approval, you can write the NCLEX exam without any verification. You will get the NCLEX approval. So you will write the NCLEX exam. This score we can provide to Ontario CNO. Okay, we can send this score report. We can ask the AFRA to transfer our NCLEX score report to the CNO. So in that case, case our process will be easier. What I am suggesting, instead of waiting for a long time for getting the NCLEX approval in the Ontario board, it is better always to do registration in Australia AFRA, then write the NCLEX exam there. Same time, when you are applying for AFRA, same time, start with the NNAS process. So, NNAS verification is on the way and you are preparing for the NCLEX exam for Australia. So, within 3 months or 4 months, you will complete the NCLEX exam. Okay, 3 months approval, then after that maybe 5 months like that. When you are getting the NNAS advisory report, same time you will be having NCLEX examination score report. So what is the use? Same time when we are uploading the document, same time we can inform the CNO that we completed the NCLEX exam in Australia. So the CNO will ask us to send the transfer request. We have to send it to AFRA and we can transfer. Okay, that is the pathway which will finish easier than going in a direct pathway. I hope you understood regarding that. So in Ontario, there are classes of registration is there. That means the registration pathway, they have a general classes is there. Extended class, general classes means registered nurses. Extended class means for the nurse practitioners. Then non-practicing class, those who are not practicing, that also we can proceed for the registration. And temporary registration also we can do, that is temporary class. And special assignment classes and emergency classes also there. You can check in the website what are these things and your comes under which category you can check. So now you got the license. What you have to do? You have to find a job. So there are so many applicants saying that it is very hard to get a job. I am searching for 3-4 months like that. So what is the solution for that? Most of the time what happens means candidate will not have sufficient requirements to start up a job. That means the employer will demand so many documents to the candidate and candidate will not have all these. So what you have to do means soon after completing your processing and licensing, before going itself, you must make sure that you have all the records with you. So which all are the tests it is required? First one, you must have N95 respirator fit test program. We know that N95 mask, so respirator fit program during the COVID time and mostly in all the hospitals they have done that one. But it must be from the official government authority. You have to do mask fit test. That report should be there. Okay, which is your size of your mask, that fit test is okay or not. That one is compulsory. You must have that report. Another report, that is your immunization report, like hepatitis B vaccination, tuberculosis, like a BCG vaccination, then mumps vaccination. All these vaccinations you have taken or not, that record must be there. Anyway, for me, I know it's not there because in my childhood I have taken and now it is not there with me. So what I have to do? I have to do titer report. I have to do the blood test. Okay, anti-globulin ratio and we have to do titer report. We are calling this. Okay, hepatitis B titer report, mumps titer report. So based on the job requirements, you can see which one are the test titer report you have to do. Those tests you have to do. That is must. Then another test is TB test. What is that name? Mondox test we have to do. Mondox test report. Recent Mondox test report must be there. If it is showing positive, they will reject. But if it is negative, okay, we can proceed. And there is another one is our BLS, the basic life support, that they are calling their CPR and first aid certification class. AED, like that class we have to attend. A basic life support also is acceptable because it contains CPR. Then we must produce police clearance certificate, which all are the countries you were there past 5 years or 10 years, that all PCC you must produce. That should be PCC validity always only 6 months will be there. So recent PCC you can take at last. That is important. Initially itself no need to be make ready the PCC. Okay. So after getting the license, after that only you can take the PCC from all the authorities. So almost if you have all these documents within 1 or 2 months, you can secure the job easily in Ontario. Almost 1 month you will find a job. And regarding the job, you will get the jobs in the hospitals, long-term care, then elderly old age homes and all, even home care also available, rehabilitation center. Based on the center, your duty schedule it will be there. That means in the hospitals mostly 12-hour shift will be there. Sometimes friends are saying that they have 2 nights, then 2 days, then after that continuous 4 days or 5 days off, like that it is there. It depends on the hospital management how you are getting the duty shift and all. Then a long-term care mostly it is an 8-hour shift. Then home care sometimes a 12-hour shift. You will get overtime fees also, mainly in the hospitals. Most of the time hospitals overtime it will be chargeable. Okay, so you will get that amount also for your salary. And so regarding the so many candidates are asking regarding PR, visa and all. So this immigration program it can change rapidly. Always you have to consult the immigration consultants when you are traveling. That time what is the things you have to make sure. Apart from these requirements, license and requirement. Okay, you have the license. Okay, Nursing Manthra can assist you until the license stage. So you must have the license now. But how you will travel there? Visa, okay, PR and all status and all, how you have to proceed, that you have to consult with the immigration consultant. As Nursing Manthra is not an immigration consultant, so until that process we can proceed in your applications. So there will be 2 options is there. One is express entry, that is OINP International Student Offer Letter or a job offer letter. If you have the express entry. Regarding visa processing, I think you can consult with the immigration consultancy. They will guide you properly how you will get the PR and all in Canada. Okay. Then regarding the salary, it depends on where you are working. Whether you are working in a hospital or long-term care, rehabilitation center or home care, depends on that your salary it ranges. So how many years experience you have? If you have more experience, you will get more salary. Then what type of nurse you are, whether you are a registered nurse or nurse practitioner or LPN, depends on that also salary it can range, and location of your job. Then whether you are hired by the hospital or the company directly or through an agency. If through agency means the salary will be less. If directly through the hospitals, salary will be more. Even if you are in your home country, if you have the license, then you can apply for the job. Okay, there are so many job sites are there. You can go through the job sites and you can apply for the job. If the employer interested in you, they will conduct the Zoom meeting or Skype interview and all. And if they are really satisfied regarding the visa processing and all, it will be easy for you once you get the offer letter. Then normally the RN in the hospitals, registered nurses in the hospitals, the salary range that is $35 per hour usually it is getting. Then after 5 years of experience, it will increase to $42 per hour. This current it is showing like that. And these years and all, they will be having one chart is there. So after 5 years, compulsory they have to give this amount like that. This fixed one. $42 per hour after 5 years. After 8 years of experience, they will provide $48.17 per hour in Canada, experience in Canada. So there will be Ontario Nurses Association also there. They will also help you for any problems of the nurses if you have. So always you have to check the Ontario Cno website for the checklist and all, which all are the checklist it is required, and what is the RN program, PN program, NP program. Then another education program is that is RN prescribing education program like that. So like that is for education study visa. Those who are coming as a student visa purpose, they can see the programs also. Those who want to study nursing programs in Canada. Suppose if you completed the diploma from India and your RN program you can do in Canada. And for the registered nurses, they can do nurse practitioner program. So for that also we can apply for the visa and we can reach there. After that we can proceed for the nursing license in Ontario. These are the things which I know, and for making the application in Ontario board, whatever the things required, we can assist you for that. Okay, this is about CNO, College of Registered Nurses, Ontario. Coming weeks, I will try to explain all provinces in Canada and the USA, like that continuation. I wish I could have do that one. Then this is all about it. If you have any doubts, you can come up on chat now and you can ask the question so that if I know, I can reply to you. Are you processing also NCLEX? Yes, Hawaiian, means I am doing NCLEX application. I think you are asking for Canada or USA. All the authorities, we are doing the process. We are doing for this USA, Australia, New Zealand, Ireland, then Canada, UK. All these countries and Gulf countries processing also, we are doing it. So if you need any assistance, you can chat in WhatsApp, which is given here. So you can message them in WhatsApp, it will reply which country you need. According to that, we can select it. Canada, any diploma nurse vacancies available now? Diploma nurses vacancy, first of all, what you have to do means you get the license ready. Then only anyone will take you. Okay, if you have the license in Canada for RPN license, if you have, I heard that RPN nurses have more vacancy than registered nurses because RPNs are less compared to the registered nurses. They will maximum they can take the RPN nurses. That's why RPN nurses have more demand. So diploma nurses will be the like RPN nurses or LPN nurses. So you will get the job. That is, of course, you will get. But the thing is, you must have all the requirements met and all the documentation. License must be there. Then you can apply. Then you will get it. Okay. What type of exam need to write? I think for the diploma nurses, exam that is REX-PN exam. You don't worry about that one. Nursing Manthra is having the study materials for practical nurse exam and NCLEX-RN exam also. So if you need the nursing diploma nurses REX-PN exam materials, you can contact us through Nursing Manthra WhatsApp number. So which is given in the description. We will guide you for that one. Okay, what to do. Are you doing Canada processing? Sharanya Sasi. Sharanya, actually we are doing the Canada processing as I discussed in this live session. We are doing until you get the Canada license. But after that, the visa processing, immigration, PR and all we are not doing. But until you get the license, that documentation related to our studies, licensing and all, I can help you with that. And visa, immigration, job finding and all, we are not assisting that. Thank you, Madam Priyanka. Thank you, Priyanka. How many time it will take for all process? It depends, dear. If you are moving through Australia to Ontario, maybe within 6 to 7 months, because of course we must get the NNAS advisory report. In coming weeks, I will explain another province which is more easier than this Ontario. So you will understand after hearing all the live sessions, okay, all provinces processing, then you can select which province is good. Okay, processing and according to your convenience, which will be better. Some provinces are there, they don't want the IELTS report. For mostly all of them are preferring that. Like that, each session once we reach the live session, you can watch all the Saturday live sessions will be there. Timing will be published in the YouTube and all the social medias. So you can just go through that. All the province just hear once and select the province, then only proceed with the application process. Okay. Anyway, NNAS report 6 to 8 months it will take. That's why it is delaying around 9 months, 10 months like that, complete processing. Another board, those who don't want the NNAS report, that board within 3-4 months, even I think 2 months I got the application for Alberta annual, 2.5 months I think. So like that province is also there. So next week, coming weeks, I will discuss each province I will discuss detailing. Okay. Amount, Priyanka, amount I already informed in this live session. Once the live session process, it will be saved in YouTube, so you can watch the video again. So in each section, how much it will cost, I explained. I guess I explained. And regarding the verification from the college licensing council and all, you have to consider extra charges for that. It depends. Each member's documentation it differs. ANM qualification, any job available now. ANM qualification, I think they were asking for diploma nurses, those who completed for 2 years. So if you are ANM course 2 years, you can apply for RPN category. But if you are not receiving, then another healthcare support workers in that category, HCA category, healthcare assistant category, you have to do. But if your curriculum is perfect and as per RPN requirements, it is met the education qualification for 2-year diploma, then they can consider it. Princey, Terrain, all Canada state same process, madam. No dear, each province have different requirements are there. Okay, some provinces they don't want NNAS report. They will accept the BES report, ICAS report, ERS report and all. Some provinces compulsory they need the NNAS report. Based on that, the processing time, the amount, it differs from each province. Where is your office, ma'am? Our office is in UAE, it is there, and another office is in India, Kerala. Kerala, it is in Calicut, Tamarsheri, there is office is there. You can go to the website, nursingmanthra.com website, you can go. There the office location has the Google Map locations given. And also the services which is provided, all the details have mentioned in the nursingmanthra.com website, you can see. Okay. In Google, if you are typing nursingmanthra.com, you will direct you to the website, and what are the services we are providing, all the details, and even all these authorities blog also I have mentioned. So you can go through the blog, how much will be the fee structures, whatever the process we have to complete, everything I have mentioned in the blog. And easily you can connect to us also through the website if you are clicking on the WhatsApp link given in the website. Rubia Kari, yes ma'am, 2-year diploma. 2-year diploma can apply for RPN and NNAS advisory report. What is the educational qualification which is equivalent to the Canadian diploma program? If it is equivalent, then only they will accept. Okay. Based on our transcript. Transcript is mandatory always. In the transcript, it must be that how many course of theory we have attended, how many course of hours of practical training we had. It depends. Okay. So each university it differs. Each authority the transcript hours will be different. Based on that, they will calculate total subjects, which are the subjects we have covered in our study, how many hours we have practiced, or theory hours, how much. Based on that, NNAS will prepare one advisory report. We are eligible or not. Based on that only, they will accept. Then, Princey, how can I start process where I can meet you? Do you have 100% sure English question, sir? There 100% sure English question no one can provide you. And what are the things you have to do? You must understand the concept of each theory content. You must have the concept. We have the study materials, but I cannot give the guarantee 100%. But those who studied my study materials, they all got passed in the English exam. That I can give guarantee. Okay? But it is depends on your memory. If you are just reading and if you are not by hearting in your mind and not understanding the concept, then you cannot think logically and write the correct option in the exam. So if you are preparing for the NCLEX exam, then you must start at least 6 months before the exam. You can start studying, prepare your own notes. Okay, study materials maximum available in the market. The top like study materials you will get in Nursing Manthra. Okay, and the video classes will be there. That will be sent to your mail ID. So you can watch at any time, whenever you are getting free time, you can watch the video classes, and you can the mock test will be there. Then you can attend the mock test. Then there will be questionnaire, question bank like that. PDF files will be there according to the system. Each system wise it is divided. So you can just in website we have mentioned regarding study materials and some video classes details also. In website we have given some videos related to our classes, how our classes will be. Actually that classes I didn't keep more in YouTube. So you can just go through the website. Okay, NCLEX study material. If you are clicking on that, you can find out the video classes and all the things. How to purchase NCLEX question is that latest one. Yes, the questions are latest one. Whatever the thing, we are getting the questions in the computer when we are sitting there. The questions, it will not come directly as we study, but we have to understand the content of the question. So it may be asked in different way, but easily we can recall the idea will be and we can select the exact question. And there will be new generation NCLEX questions there. That is like a case study model it is there. In case study model, each sessions, okay, we have to select exact answer. So second answer when we are writing, we will understand, okay, first question I have written wrong, but we cannot go back. So read the question correctly, okay, understand, always think about a patient is in front of you and you are treating the patient, all the questions, you imagine like that, in front of you that patient is there. Then easily you can answer the questions. So in our study material, NCLEX exam tips, strategies, everything has mentioned. So if you are purchasing the study materials, you can easily understand that. Kudiya ma'am, if I will go to Canada for job, must I complete IELTS or anyone? IELTS or CELBAN must be needed in Ontario province. So there are other provinces, only one province without IELTS for Indians they are taking. So that province you can move. That also better if you are lacking the English language. Only one province, okay? Next coming days videos I will explain these things. I am in Canada. I wish to do job in UAE. What will do? Hi, dear. Actually, if you are in Canada, if you want to come to UAE, you can contact Nursing Manthra WhatsApp number. So in UAE, we have 3 authorities: DHA, MOH-DHA-HAAD. So which authority you need? NNAS, Shahada Authority. So many it is there. So if you need the job in Dubai, means DHA you have to complete DHA eligibility letter. That all processing we are doing. And also there is one important thing is that if you already have the Canada license, NCLEX-RN exam already you pass in Canada and you have the license, means you will get exam exemption in UAE. That is important thing. Those who have the US NCLEX or a Canada NCLEX, you will get exam exemption. NCLEX in the sense that your registration must be valid. So exam exemption you will get. Other than that, the verification, Dataflow verification you have to do for education, employment and license and good standing. And then we can get the eligibility. With the eligibility letter, we can search for the job. You can see my videos in YouTube regarding DHA licensing process, MOH licensing process, DHA-HAAD-SAUDI-OMAN-BAHRAIN, all the authorities licensing process videos you can search in Nursing Manthra YouTube channel. Everything clearly mentioned. Okay. So if you have any doubts, you can just message here. I think yeah. What are the MSN specialties provided by Canadian universities? I would suggest you to go for nursing practitioner course if you are moving, because nurse practitioner will have the $80 per hour, like that the salary is there. So if you are a MSN nurse, you must have enough intelligence to study the nurse practitioner course. That will be useful, okay, and it is demandable profession also. You will have more workload, but you will have a what is the dignity, everything will be there, and salary wise also it is more than comparing to MSN specialties. Nurse practitioner course will be good thing, okay. Then MSN specialties regarding critical care, emergency, like that, so many specialties are there. So if you have the MSc like medical surgical nursing in critical care or cardiothoracic nursing specialty, if you have, you must do the experience in the same field. Then you have the salary hike will be there. You will be directed to that particular specialty. But if you want to study some course, then go for NP, okay, nurse practitioner. Hi, good informative video, ma'am. Thank you. So if you have any doubt related to Canada, Ontario province nursing licensure process for internationally educated nurses, you can contact in Nursing Manthra WhatsApp number. Even if you need the assistance to do the documentation work, also you can contact Nursing Manthra. Okay. And coming weeks we will explain. We will be live session regarding other provinces. Okay, Alberta, then Saskatchewan, Brunswick, all the boards we will do. Okay, not board, actually this province. Where we can get better salary, Canada or UAE. This is depends on so many factors, Quincy, because expenses, only getting salary don't count like that. Expenses, then the tax, salary will be more in Canada, but nothing will be like a saving. How much will be the in your hand the remaining balance, that you have to calculate. If you are in UAE, registered nurses can get 5,000, 4.5 thousand AED to even government and all 10,000. Okay, some are getting more than that also based on the experience and all, but minimum we can say the average we are getting in UAE, that is 4,000 to 7,000 in that range, dirhams. And where your location, where you are staying, your expenses, and how much will be the balance in your hand, that depends. Same like in Canada, which province you are selecting, okay, the tax, how much you have to pay in that province, and their accommodation, all these things, how much will be your total expense, and finally what is in your hand, that you have to check. Don't always check for only for salary, always check what will be there in my hand after all these payment. Okay. Scholarships will be there. I am not going more detail regarding the scholarship. I didn't research about that because we are not doing the student visa program and we are not conducting. Only those who completed the like nursing courses, they can move that documentation we are doing. So I am not sure regarding the scholarships and all. You can find out easily in websites. They will be mentioning regarding that. Okay. I have actually a question for MS Professional, very explanatory. The animation in the video were helpful. Where can I purchase the complete videos? The question bank ebook. Rasia, actually the videos which I have given in the YouTube, that is not that much I have already published actually in the YouTube regarding NCLEX videos. Okay. So NCLEX videos you can see in my website. I think you have watched the website now, right? Okay, so if you are interested, you can contact Nursing Manthra WhatsApp. So in the website there is WhatsApp icon is there. Click on that. You will direct to our WhatsApp page. So just to chat, you need the NCLEX study material like that. So then you will get the like how much cost it will and all the details it will mention. Once you deposit the amount, then the materials will be sent to your mail ID. Okay. So whenever you are getting the free time, you can watch the video. And thank you. If someone have any doubt related to our today's topic, that is College of Registered Nurses, Ontario. So for that, any documentation doubts, anything you can ask here. So Nursing Manthra provides the NCLEX study material for all the provinces. Okay, USA, Australia, and Canada NCLEX materials, NCLEX PN materials, and NCLEX-RN materials also we are providing. Which one, according to your category, you can select the materials and you can purchase the materials. I can give the guarantee that if you are giving more hard work on that study material and you are studying, of course you will pass the exam within first attempt itself. That much explanatory videos with animation I have given. Okay, so it will be more easy for you to understand each topic. Clearly explained all the topics, and questions practice is there, mock test is there. Okay, or if you are going through all these things, surely you will get pass the exam. And those who need the Cno-Ontario processing, you can contact in WhatsApp. You cannot take a printout there, and validity usually we are giving for a 6-month duration. And after that, if you could not attend the exam, then we can extend also. There is no problem for that. That time you can just contact us through WhatsApp. And you cannot print out. Okay, you cannot download or you cannot print out. You can watch in online. You can watch the videos and say the questions like that. You have to study. All the NCLEX materials are like that. I love you, Princey. Thank you. So I hope you all understood related to this today's topic. So this video will be saved, and you can watch the video once and once again. You can watch, and if you are interested to proceed with the Ontario state, then you can contact the Nursing Manthra. So I am closing the live session. I think there are no further chats there. So signing up, Shinsi. Okay, my name is Shinsi. Signing up. Bye bye. Thank you.